So today we are going to discuss about homeopathy, and many people have misconception about homeopathy. This is not effective. This takes a long time, and they don't want to try actually. But our recent experience, the pandemic that we faced actually. So I have seen there many people save their life with the help of homeopathy and Ayurveda. So today I have with me Dr. A.K. Gupta. He is a very renowned homeopath. He is a professor and he is practicing for more than 20-25 years. So I'm going to discuss with him what are the causes of this ignorance and how can we educate people, and you will be able to understand how homeopathy is going to help you. So welcome, sir. Welcome, Dr. Gupta. Welcome to the studio. So I am trying to spread the message about homeopathy, how this is the best way of treatment to treating the disease. So just to educate our audience, how they can help themselves with the help of homeopathy.
Well, first of all, I must congratulate you, Mr. Srinath, for starting this particular awareness campaign about homeopathy. Though homeopathy has been there for the last more than 220-30 years, but still it has not been able to reach the place where it should have been by now.
Yeah.
And there have been certain reasons for that, I mean, which have been from the ignorance because of the non-sharing of things and not getting that media coverage as other system of medicines are getting it.
Yeah.
There's not that kind of an advertisements so that people do not see much.
Yeah.
It is only from mouth to mouth, I mean, publicity, like the one patient has taken a treatment and then he gets better, and then he recommends to the other people, then you get it. But at the same time, like the government has also taken up started the Ministry of Ayush, whereas homeopathy is also part of it.
Yeah.
But there also, unfortunately, homeopathy has not been given its due over there. It's precisely been the main, has been emphasis on either on Ayurveda or yoga.
Okay.
I don't know, but I mean, this is the general perception because the Secretary of Ayush, he himself is an Ayurvedacharya. So I think he has got a soft corner for that, and probably, I mean, I'm not, saying, but this is what it appears. But anyway, nevertheless, I mean, that homeopathy has ever, been there because of its efficacy and regular showing the results. So it has withstood the time of more than 230 years. And I've been in practice for the last more than 45 years. So when I started my practice, it was considered to be very difficult to do a practice because very few people were aware of that homeopathy, or those who were aware of the homeopathy, they used to mostly go to the charitable clinics because that was a time when the homeopathy was used by the people in the offices by hobbyists, those who has learned as a hobby. So they used to read books, Metrimedica, Boric and all that, and they used to treat their, in every office you would find 2 to 3 homeopathic lovers or homeopathic enthusiasts or practitioners. So like whether it is a bank, whether it is an office, so they used to, give medicine and charge, either don't charge at all or they would charge very minimal. So what happened, it definitely gave a little mileage to the people, those who took medicine and got better.
Okay. Yeah.
Unfortunately, those were self-styled doctors. They were not qualified practitioners of homeopathy. They have read the medicine, Metrimedica part. They have read the medicine and try to, match the symptom and give the medicine, which is the basic principle. And there's no doubt about it.
Yeah.
But where the medicine has to be applied, you need to have the knowledge of disease also.
Yes.
So,
yeah.
So they were having the knowledge of medicine, but they were not having the knowledge of disease. So there were times when they failed also because they did not know the actual disease or the complications of it. So like, I mean, initially people would have been suffering from, somebody had a stomach ache, some had a cold, sneezing and all that. They gave medicine, so they become better. And then they started feeling, I mean, due to confidence. So they started dealing with little more, I mean, serious problems also. People started talking in a friendly manner. Okay, that has become all right. So why don't you try it? I mean, this, I've been going to allopathic doctors, I'm not becoming better. So there they took the chances to give, I mean, medicines to those people. In certain cases, they succeeded. In more the cases, they could not succeed. But there it was not the failure of the homeopathy.
Yes.
It was a failure of that particular person who was giving the medicine, which was so-called homeopathic medicine. But it was not a remedy per se for that particular patient. Because as we say, that homeopathy is totally based on individualistic approach. You need to identify the individual into that particular patient.
Yes.
And know the, I mean, basics of your disease. Like having pain in abdomen is a very common thing. But you have, initially you might have treated and the patient become all right. But every time, I mean, the patient having abdominal pain is not simple. Abdominal pain is like a Pandora box. You've got so many organs, so many, I mean, tissues are there which can cause pain. It can be your plain gas, it could be indigestion, it could be constipation, it could be diarrhea, it could be infection, it could be pancreatitis, it could be liver infection, it could be intestinal obstruction. So these things they were not aware of, those initial days practitioners.
Yes.
So they only thought like the patient has been there who has got a pain in abdomen and he feels better when he, I mean, bends double. So colocynth is the medicine. Yes, colocynth definitely is a right medicine. But without knowing this particular, I mean, pain was because of the renal colic. It was a stone pain, so which was being treated by a simple medicine like colocynth with one symptom only, without realizing the actual cause of pathology or the cause of the, I mean, pain. So there they might have failed. So that had been the one, I mean, reason that those patients who took initially and got better with simple things, but when they started dealing with little, I mean, serious diseases and all that, they could not find that relief as they were expecting. So they started getting, I mean, double-minded or losing faith in that. So this has been the basic criteria for the, I mean, homeopathy getting popular, but homeopathy getting not popular up to the level as it should have been. And ever since those, I mean, self-styled practitioners, they gave a good name. I'm not saying all. There were few who had been excellent. They've been very good practitioners, but not all. So this is what happens. Like, I mean, in a bank or in an office, you have got four I mean, people giving homeopathic medicine. One given this way, the one given this way. So you keep trying this and this, and none of that has got the actual knowledge of the disease. So what happened? Thinking it ho jayega, I mean, it will be all right. But the, I mean, problem got worsened. And then they time had to go to the hospital. And that time they, I mean, unfortunately, the hospital people say, what have you been doing? You've been going to homeopathy. They do not, blah, 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 which is again a reason. But ever since that, I mean, qualified homeopathic doctors have started coming, they have been a regular course. And I mean, to tell you honestly, a homeopathic doctor studies the same course what an MBBS student studies. That is, again, it's a 5.5 years course. We study all subjects what MBBS students, I mean, read. And they also undergo the practical training, I mean, like medicine and surgery. And after that, they got a 1-year internship. Nowadays, we have got, I mean, on homeopathy, there's, I mean, after the graduation, like we call it the BHMS, the MD is also there for 3 years, and now the PhD is also started. So now the scenario is altogether changed. And no more those, I mean, hobbyists are there, because with due regard to them, because initially they were the one who, I mean, brought homeopathy name in every office.
Yes. Yeah. Mm.
So I mean, I'm not giving any disrespect to them, but
Mhm.
what I'm saying, since you were asking the reason, I'm telling you, giving you the exact reason for that.
Yeah.
So ever since the qualified doctors have started coming, they have the full knowledge of diseases, so they can diagnose the disease properly and give the medication and treat the patient with the complications also which are likely to be,
Mm.
or give that management, which is a very important part of the while treating a case. Giving medicine is a one thing, giving the proper management where you need to, what are the restrictions, what are the do's and don'ts. So they have also to be given into that account, which initial people were lacking, but now the qualified doctors is very much aware of. So he can read the parameters of these reports, whether they are in normal or not, or what is the levels of this. The patient is going into shock, patient is going to get into a complication. So which we can see from seeing the report, seeing the x-ray, chest x-ray, or whatever x-rays or CT scan and the ECGs, which was missing in those days.
In
So
earlier.
now
Yeah.
yes, so now it has been at par with a modern medicine. There's no doubt about it. A qualified homeopathic doctor is as good as an MBBS doctor, and he can understand, treat, and take care of that patient in a very well manner.
Yeah. So, sir, one step the government has taken just to popularize this country medicine like the Ayurveda, Siddha, and homeopathy and all that. So one step the government has taken. What do you think the homeopathy doctors at individual level should do to promote homeopathy?
Well, yes, it's a very important question. Well, every homeopathic doctor is doing his bit and doing his practice and earning his bread and butter from there. But unfortunately, the only thing is that every practitioner does not have that kind of a stage or a forum where he can showcase his cases.
Yeah.
And some people are reluctant to, share. This is a little, I would say it's a short-sightedness.
Yeah.
You do not want to share your, experience, thinking what will he say, or he'll take up my, prescription. So, which is a very shallow-mindedness.
Yeah.
But on the whole, if each and every practitioner starts keeping a record, because earlier the basic thing was you had given the medicine, the patient will become all right, but there is no record.
Yeah. Yes.
So once there is no record, you can say anything from your mouth. It looks, you are, beating your own trumpet, but without keeping any record methodologically, like when the patient came, he was in such a position by taking his reports, medical reports, or photographs or videos. It was the position when he came, and after the treatment, this was the situation where he started feeling better. You can very well see it with the reports, again with the photographs or with the video. So this is a record keeping is the most important aspect with evidence.
Yeah.
Unfortunately, people were not very keen in doing this, and they were having reluctant because of various reasons. Because it takes time to take up a complete record, and you need to have those, cameras and all that with you. Now, of course, people have started using it with the video cam. What you call mobile. So you are able to do that. So keeping this record and then showcasing it to the patient or at any forum.
Yeah.
Where it has been discussed, like you have a monthly meeting, of the doctors get together or a study group. So there you can share. So once people start doing this with keeping a complete record and showing it, things would become much better. Unfortunately, there is again another problem I would tell, that in homeopathy, we have got the basic concept. What Dr. Henneman has given is the one which is very true, the single medicine and minimum dose, it is fine. But over a period of time, we had seen, times have been flying. things have changed.
Yeah.
There are cases where you have to give up, medicine in the form of a tincture, where you have to give a two medicine because of the patient's requirement.
Yeah. Yeah.
Because nowadays, in a patient does not have that much of a time, and patient becomes impatient, and he wants a quick relief.
Yes.
Or so that next time when he comes to you, he should have definitely some relief. In that case, you might have to give an acute remedy to take care of his acute problem.
Yeah.
Earlier, which was the classical method, was you take up a complete case and give one constitutional medicine. Again, I'm saying I'm not against that. I'm not, being biased or that, but I'm telling you the actual reasons that things have been going from this way to that way.
Yeah.
So, like people are, not open with their kind of a practice. They feel shy sometimes. Suppose if I tell them that I've given two medicines, so what will they say? Or I've given a tincture, so I might be becoming a laughing stock among them. So this is one also very big reason that individuals do not come forward very often.
So, yeah, please.
Yes. Please. Had this entire fraternity of homeopathy started believing that, okay, this is his experience. You may agree or you may not agree, but he's sharing his experience, so you should encourage him. Okay, it is good, we would try. But telling them this is not homeopathy, that becomes the biggest drawback in our system. When people, you would say that what kind of practice he is doing, that is the only homeopathy. So that becomes a real tough situation. Because if you see in modern medicine, they do have also difference of opinion. They do have but they never say that this is not allopathy, what the other doctor has given.
Yes. Yeah.
And people try to, push forward their own kind of a system. Whereas as a matter of fact, I've been, in the practice for the last 45 years, I've been running, I've been teaching also, and here I've been giving my lectures all over the world. Being a practitioner, being a teacher, being a researcher. So I have found that one should go with an applied homeopathy, rather than making this homeopathy or that homeopathy and that homeopathy as an individual homeopathy. Because patient is not bothered which method you are using.
Right.
He is concerned with his welfare, his problem should be taken care of. So similar way, if I tell you, we are staying in Delhi, if you want to go to Connaught Place, so there are different routes
to
reach. When everybody knows, they have got their own favorite routes, they always follow that. So if you say that the route which they are following is the only route which can take you to the Connaught Place, is wrong.
Yeah.
There are other ways also which you may not be knowing. So there is no harm in learning and knowing about the other way which can be used, but should not pester upon, because the way which you are taking to the reaching to Connaught Place is the only way. So this is something where we need to imbibe this feeling and start understanding this, because this way we lose our integrity.
Yes.
So when you have got 5 different approaches, people say, no, this is the one, this is about 5. So the other person gets confused, that they say you do not have a unity in your own, you don't have a standardization of your own. So that becomes a little problem. So we my sincere advice, please don't criticize your fellow colleague.
Yeah, there's
whatever medicine he has given, it has been given. Now it is in your hand. You can do the best, whatever you want to, but without condemning the previous doctor who has been treating you. So that if you start respecting the other doctor, they will also respect you, and it will take a time. Very soon you'll find that everybody is being respected, which everybody wants. But if you keep fighting within yourself, the third person would not give you the due respect and due, recognition. That's another problem.
Yeah. So I am also thinking about the homeopath doctors are not using technology very much actually, because there are so much of social media available, WhatsApp, Facebook, and all that. The doctors can create a community for themselves. Whoever patient is coming to them, they can create a community with them, and they can with them they can have a regular touch with them, and it will invite the new persons also to their.
Yeah, we do have community. I mean, we do have got association. For that matter, I am president of Homeopathic Medical Association of India, Delhi State Branch. I've been Liga Medicorum Homeopathic International. It's an international body. There also I'm a life member. Asian Homeopathic Medical League is there. So there are already associations are there. But again, the difference comes with when everyone tries to say that this is the right one, I'm the right one. So that causes a little problem. But I mean, now the times are changing. People are, using technology to a greater extent. I mean, I've been treating, cases of motor neuron disease, which is, my research topic also. And I have got a full record from day one to the, this thing to the last. So that shows like what is what and what is what at what time, which shows them that a variation in their test reports, variation in their photographs, variation in their videos, which can be very well seen and accepted and appreciated by it. But if you don't keep a record, again, by mere saying I did this, I did that, will not be able to give the any recognition. So we have to go with the evidence-based, homeopathy. This is the need of the hour.
Yeah. My point was for the local community actually to promote the homeopathy. Suppose you have your clinic in a certain area and 100 of patients are coming to you. If you create a community with those 100 patients, it will attract the new one also. And you
well, yes, that's a good idea. Like, I mean, for that matter, we do have, I mean, in almost every area, like we've got a study groups are there. I mean, of 10, 15 or 20, 25 doctors are there. So they do meet once in a month and they do some kind of a camps also. But yes, they have not been able to follow community. Yes, it's a very good idea. If like, I mean, you, a group of homeopathic doctors pick up one particular area or slum area and then treat. Yes, this can be worked upon. Yeah. But for that matter, again, I mean, you have to have this, same-mindedness, you know. Yeah. Like, I mean, similar thinking should have been there. But there, if the people are thinking like, I mean, I'm coming here as a, senior, so I should not talk into that manner and all. So yes, there are certain things, but it's a good suggestion. Yes, I mean, it can be worked out. And like Abhi, though, we got every association, they do, I mean, they do community work, they do a lot of camps and all that, for that matter. Camps we have conducted and treated thousands and thousands of people for that. Yeah. But yes, not again taking a community. It's a good idea. So certainly, I mean, I think one can look into that matter.
Yeah, because the homeopathic medicines are not very costly actually. Even if
well. Let me tell you. This is also one very important thing which needs a good debate and understanding. Like the patient coming to me in a Mercedes car, right?
Yeah.
And if I charge him my normal consultation fee and all that, and a handsome amount,
yeah.
So he says homeopathy is cheap,
yeah.
Which I feel very bad and offended of.
Yeah.
From your platform, I mean, since it's a public platform, I would like to make people understand that don't you think that homeopathy is cheap. If you think this way, your ideology becomes a little different.
Yeah.
When a patient goes to an allopathic doctor, there he never even asks,
yeah.
Why is he charging this much fees? if he goes there, he pays 500 or 700 or 10 or 1,000 rupees as a consultation, and then he writes a prescription where the medicines have to be at least 1,000 to 500 to 2,000 worth, so that he can justify his fees, right?
Yeah.
But then the patient is telling some other problem, then the physician or the doctor, he recommends or refers him to another doctor, another specialist, right? There again, he goes, pays fees and buys medicines. For third problem, he goes to the third specialist.
Yeah.
You go, a person remains the same, but he is being treated by 3 or 4 different specialists for his problems.
Yeah.
Right? And when he comes to a homeopath,
he is everything.
He is treating everything of yours.
Yeah.
You are not treating, you're not giving the consultation to the 4 people and not buying the medicine of 4 doctors. And here you are giving the consultation to that one particular homeopathic.
Yeah.
Then the kind of a time he is giving a homeopathic doctor, which people don't even try to understand and realize how much time their specialists give to them.
Yeah.
They do not ask anything.
Yeah. Right.
When they come to a homeopathic doctor, they want every facility. Up a clinic, achha na chahiye. You should be, well furnished clinic. You should have a receptionist. You should have waiting room. You should have AC. You should have this thing, that thing. Those who were doing the hobby, because they were already getting a salary from their office. Homeopathy was their part-time as a hobby. So there, if they charge or they don't charge, it doesn't matter. But a homeopathic physician, or homeopathic doctor, or homeopathic consultant, whose bread and butter is this only.
Yeah.
He has to make his, family run from this. He has to make that, this thing. From where he is going to get?
You're right. Right. So my point was, I just brought this point in terms of the camping. Actually, when you are doing camps and at different places for the lower level people, so that the homeopathy can do, even if you could do the.
No, that is already being done. That's already being done. Let me tell you one thing. When the same patient who came to me on Mercedes, and I told him, you see the medicine is okay. Food, you tell me I'm ready to treat you free of cost. The disparity maintained by those patients is wrong. Yeah. They should give equal respect, equal regard, and equal money to the homeopathic doctor. Yes, if they've got a genuine problem, I think no homeopathic doctor would mind giving them the concession. Yeah. But they never say this. They say homeopathy is cheap. So this hurts a homeopathic doctor. So why should I be cheap? Yeah, right. You're right. So it is anyway doctors or any professional privilege how much he is going to charge, because he must be charging and he should charge as per his knowledge and his skills and all that. So that was not my point actually. I was talking about the camp and all that. No. See, those camps, if the camps are, that is normally been absolutely free of charge. When we do the charity, like we were running a charitable clinic also, so we do not charge there. We charge only the minimum, because there's another psychology of the patient. If you don't charge them anything, they do not give you that kind of a respect, that they do not take the treatment so seriously. Yeah. If you have charged something, so they where nothing has been given from your side, So you are not that serious about it. The moment something has been involved, your attention and this thing becomes more. So you become more regular with the medicine. Abhi kya hota hai, normally, I mean, if it has been given free, doctor will medicine, oh, sorry, I forgot. The medicine fell like this. But if you have given taken the medicine by paying, this will not happen.
Yeah, definitely.
This is also true. But again, I said, it is not a generalized, it has to be, I mean, in a person to person, you can make it a situation like that. But given free is not really advisable.
Yeah.
Give free to the patient, those who cannot afford, those who do not have the money. But not to the patients, they are coming in the cars and all that, you give them free. Why?
Yeah, definitely.
So that constraint has to be maintained, and that need to be seen.
Yeah, definitely, sir. I fully agree with you. So actually, my internet is also a bit unstable. So in the between, it gets a stop actually, and we are with hardly 5 minutes of time. So I have only asked you half of the questions. So just to finish it, I'll ask you one question, then we'll meet further whenever you are free. So then I'll complete the English one, then I'll do the Hindi one. It depends your ability and your convenience. So the one question I wanted to ask you, because since we have been under homeopathy treatment since childhood, so you know, in homeopath and including Ayurveda, the diagnosis is done basically on the basis of symptoms. So now the doctors are using the other way, like the test and all that, X-ray and all that. Earlier, those things were not there actually. When my grandfather was a Hakim, so when he was treating, he was just looking at the pulse only, and from they were treating. So earlier, these things were there. So today, just to create the awareness and to just enlighten the patient, whoever comes to a homeopathic doctor, so what kind of information he must be having with him? Like in the homeopath, generally these questions are asked whether you like the sweet food or you like the salty food.
No, I tell you, this kind of information becomes important when it is very significant.
Okay.
The person, like, I mean, if you ask general, because this is also a very big, I mean, misconception among the people, they take very long history, they keep on asking and asking and asking. And at the same time, it becomes difficult for them to answer.
Yeah.
Like they came from for the purpose of, I mean, having a pimple on the face, but they are asking, how about your menses, how about your, I mean, sleep and all that, because they are considering that pimple is the only symptom of the skin, whereas it is not. Pimple can come because of the stress, pimple can come because of the wrong diet habit, pimple can come from having your dandruff, pimples can come from, I mean, your greasy skin, pimples can come from taking a lot of non-veg and all that, so other things are there. So that is why we need to ask. But asking for the person liking sweets or, I mean, salty or fried or spicy, it is, yes, there, like, I mean, when you ask, if you say, like, I mean, which thing you like, you say, doctor, sweet, and his expression. आप क्या, what do you like to eat? कहते डॉक्टर साहब कुछ भी मंगा लो. So in a lighter note, I'm telling, but yes, it has a significance. A person who cannot, he adds the salt on it, so it is a craving.
Okay. So these symptoms are not required in all the cases, actually. That's what you are saying.
It is unusual. Something which is unusual is having an importance in homeopathy. Unusual, uncommon, and peculiar. So this becomes peculiar and. Hello.
Yeah, hello, sir. That is very unstable today. So I think I have to end it today. Then I'll message you on WhatsApp.